Medical professionals of Reddit, have you ever had a patient so lacking in common sense you wondered how they made it this far? If so, what is your story? There is a reason the instructions for prescription suppositories say unwrap and insert, and not just insert. I'm a pharmacist. One evening shift, I was working a relief shift, not my usual pharmacy. A man comes in looking distressed. Man, I had sexual relations with a woman I do not intend to pursue a long-term relationship with. Yes, he said it just like that. Me. Okay, I'm assuming there was an accident or it was unprotected. How long ago did it happen? Man, last night at 7 p.m. on the couch. Whoa, TMI, I just need to know approximate time to know if Plan B will work. Me. We have this medication called Plan B, and since the incident happened within 72 hours, man, oh yes, I got that for her already yesterday, right after we finished. We want to know if there is anything we can do to know if she's pregnant now. Me. Unfortunately not. She'll have to wait 3 weeks or so to see if she gets her period, and if she doesn't, then she can do a pregnancy test then. Theoretically, you could do a blood test for faster results, but that would also not be until a couple of weeks at least. Man, we're just really anxious because she really doesn't want to be pregnant. Is there anything that she can take to prevent the pregnancy? Any multivitamin, minerals, food? Me. She's already taken it, which was the Plan B. There are some other options, but those are prescriptions. And no, there are no over-the-counter products she can take. Man, what about me? Is there anything I can take now to prevent the pregnancy? Any multivitamins or minerals? Me! No, sir, there isn't anything you can take now. I work in home health. At my last job, I had a lady call saying she was returning my call specifically. I don't recall her at all, and when I check for anything on her, it shows we have never received a referral or anything for her. Which I tell her. She gets mad and starts screaming at me, won't let me get a word in to tell her to call the discharge planner at the hospital. Like a good 8 minutes of her screaming at me, calling me heartless, and idiot, you name it. Whatever. It's slow, and these calls are usually good for a laugh. She takes a breath. I say, "Ma'am, I'm not sure who called you, especially since we haven't heard of you before now." She interrupts with, "No, it was definitely you. You said your name was Shelaton, and you were calling from Advanced Home Health." Ah, we have detected the problem. I tell her, "I see what's going on. You accidentally called Ambercare Home Health. Let me get you Advanced's number." Then she says, "I have it. They didn't pick up the phone, so I called you guys." I was not expecting that one. 73 here, former clinical microbiologist, long ago. Still, I found myself all over the clinical lab at times, not just infectious disease. So one day, this 20-something guy, wife and mom in tow, walks in with a paper request for semen analysis pre-computer era. Okay, not the most comfortable encounter, but I'm a professional and did this drill many times. He had not been briefed by the doc and had no idea how establishing infertility in males was done. Well, okay, a challenge then. I took him aside and, using standard medical terminology, told him how a diagnosis is made and what he needed to do to provide a specimen. He wouldn't believe that I was asking him to masturbate into that container. Astonished. Then he played dumb, as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the toilet with 2 inches of urine in the cup. God almighty. The report went back. Patient provided improper specimen. Paramedic. Elderly woman complains that her mouth is dry and she felt a bit dizzy climbing the stairs earlier. Go through the whole rigmarole of getting a medical history, vitals, more detail on symptoms. Ask her what she's had to drink today. A cup of tea 10 hours ago. Any water? No. Guess what fixed it within 5 minutes? Physical therapist. Had a patient with neck pain and spasms, also complained of anxiety and heart palpitations. Asked about caffeine intake, and patient revealed drinking an average on 20 cups of coffee daily. Had a buddy who was an EMT. He was called out to a location for a gunshot wound. Apparently what happened is a father was mowing his lawn when he accidentally touched part of the mower near the engine and burned his hand. He got mad at the lawnmower, pulled out his pistol and shot it. The bullet ricocheted and hit his son in the leg. Pharmacist here. I had a woman bring in a literal sandwich bag, unseparated, which she kept all her meds in. She needed help seeing which meds she was lower out on and asking different questions on the medications. When she pointed to an Apoquel stating it was her blood pressure medicine, I immediately became concerned as to why pet medicine was in her bag, also why she is mixing all her meds in a bag in the first place, only to find out that she had been throwing her pet's med inside her bag of medicine. So Lord knows what she's been giving her dog or taking herself. I immediately stressed how important it is to keep medicine in its original container to protect the medicine and herself, and to know the directions of how to take it. I've seen her a few times since then, and glad to see she has since taken my advice. But how any pharmacist or doctor hasn't advised her on this before is beyond me. Physiotherapist. For those that don't know, after a total knee replacement, you basically have a 6-week window after the surgery to regain the range of motion. If you don't regain the range in those first 6 weeks, it ain't coming back. Had a patient who was a farmer, who was very enthusiastic about regaining the range because he needed to be mobile for his work. Saw him the first time about 5 days after surgery, showed him all the basic exercises, told him to not do any farm work for at least 6 weeks, and told him to come back to see me once a week for the first 6 weeks. He disappeared and came back about 8 weeks later. His range was non-existent, maybe 30 degrees of range in total. He was visibly mad at me, as if it was my fault, actually was shouting and calling me incompetent. Our conversation went something like this. Have you been doing the exercises? No. How often are you doing farm work? Every day. Why haven't you come back since the first appointment 8 weeks ago? Too busy with farm work. So to summarize here, you did absolutely nothing that I told you to, and this is somehow my fault. Never saw him again. Rural ER doc here. 35-year-old female walks in with right-sided jaw neck swelling. I think it happened because I ate some meat yesterday that my body is reacting to. 10 minutes later, oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. Not me, but my mother would pick up shifts as a nurse sometimes in labor and delivery, and she had met a handful of women who didn't know the baby was going to be coming out of their vaginas. Like no clue. My mom usually said something like, "How you got it in is how it's coming out, honey." This was the late 90s, early 2000s. Not me, but my wife, who is a vet. Had a client who got mad at her because he didn't realize that once he neutered his dog that he wouldn't be able to breed it. Working midnight in the ER. Family brings in a 4-year-old at 2 a.m.-ish. I ask them what is wrong. Them, ask him, the 4-year-old. He said he needed to see a doctor. Me, did he say anything was wrong? Them, no, he said he needed to see a doctor, so brought him. A quick back and forth that firmly establishes that they actually showed up in the ER at 2 a.m. purely because the 4-year-old said he needed to see a doctor and they don't know why. Me to child. Why do you need to see a doctor? Kid, the doctor has suckers. Me, well, to be clear, it is the parents who lack sense and not the kid. Had an 18 or 19-year-old girl come in my ER with some complaint that required an X-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex and there was zero possibility of pregnancy. We did the test anyway, and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant because she'd never had sex. That was positive too. We gave her a few minutes to herself to figure out what the hell happened, and when I returned to check on her a short time later, she asked me if she could get pregnant, even though her boyfriend didn't go all the way in. She 100% believed that long as his penis wasn't entirely in her, it didn't count as sex. It took nearly a half hour of explaining reproduction to her for her to understand that whether it's halfway in or all the way in sperm travel. Not a personal experience, but one from a colleague of mine. I only saw the pics. So this 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally, and as planned, he recovers. Every care and meds that he needs to take are prescribed, explained, and medical appointments with a cardiologist or rhythmologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answer any calls from the hospital to know of him and reschedule. This went on for around 3 years, until he shows up without former warning and asks to talk with the doctor that did the procedure to put his pacemaker. People are weirded out, but seeing that on that day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside his shirt. The man explains he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off, and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker that should have been kept inside his body, dangling outside of it, being held by the left bra cup, with a big infected open wound above it, with the pacemaker lead still inserted onto his veins and connected to his heart. Nobody has any idea how the man let that situation come to be, or how he didn't die of sepsis or any other health problem that may appear for that matter. Had an adult male patient who needed a Foley catheter. His mother was in the room, and they both lived together in the backwoods of TN. I informed them both of the order for a catheter, how it works, and why it was needed. His mother stated, "Well, he's still a virgin, and I'm not sure I'm comfortable with his virginity being taken in a hospital." I work in veterinary medicine, and clients are absolute idiots who are convinced that they are the smartest people in the world. It is amazing that pets actually manage to stay alive. People will believe just about anyone else over the advice of their veterinarian, their breeder, their relatives, their lawnmower, the person bagging their groceries. I had a client blind their cat with tea tree oil because they read about it on the internet. Clients change their pet's medication dose for whatever reason. That's really fun when it is insulin. Not follow post-op instructions, causing their pet to eviscerate itself or blow the knee we just repaired. Feed their dog pot roast with garlic and onions as their bland diet for GI upset. Heck, last week I had a client scream at me because we didn't give her an exam room with a view. We don't have exam rooms with outside windows. Saw a chart once where a person came in for a burn to their eye. They told the doctor they read online that warm milk in the eye can help with irritation, and their eyes were irritated. So they boiled milk and then poured it in their eye. Burned it all. Once had a guy come into the emergency room because he snorted a random white powder found in a plastic bag left on a random bench in the middle of a sketchy park and started feeling suicidal. EMS here. Had a diabetic in his 40s who refused to take insulin since 2012. It was 2020 at the time. When I took his blood sugar is only read as HI, meaning it was over 700 for glucometer to not read it. Upon seeing this, he asked me if that was high and then went, "Is this cause of all the ice cream I ate?" Played Facebook Messenger video with his girlfriend the entire time. Met him later on the parking lot after he got discharged. And it took this man less than 50 paces from the ER door to rip off his bandage covering his IV and play with the IV wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a band-aid to fix it. We had to walk him back into the ER and bandaged his entire arm with gauze so that hopefully by the time he got it off, it would have clotted enough for him to not end up exsanguinating himself. I was using meth for weight loss. Have heard a few times actually. Pharmacist. Don't even know where I would begin for some of the ridiculous situations I have had. Up there, however, has to be whenever I had a lady swallow a full box of suppositories and came in to complain that the issue has not cleared up, and the medication tasted bad and was hard to swallow. Do sometimes wonder how people put one foot in front of the other